Myself, Kumari, optometrist, Sankara Eye Hospital, Bangalore. This video about the Jackson cross cylinder. Jackson cross cylinder is a technique to find the presence of astigmatism and refine the cylindrical power and refine the cylindrical axis. The objectives are to know what is JCC and its optics and principle, and how to refine the axis and how to refine the cylindrical power. A word said by Dr. Edward Jackson, JCCs are far more useful and far more used in clinical refraction. What is JCC? JCC is a combination of two cylinders of equal strength with opposite sign placed with the axis of 90 degree to each other and mounted in a handle for flipping. It is also called as a flip cross cylinder technique. Optics of the cross cylinder. Your typical JCC lens has a spherocylindrical lens. It combined with the cylindrical power and spherical, which will be twice the power of sphere with the opposite sign. Example, plus or minus 0.5 diopter JCC has plus 0.5 diopter spherical combined with the minus 1 diopter. This results plus 0.5 diopter cylinder in one meridian and minus 0.5 diopter cylinder in the other meridian. The spherical equivalent is 0. These are the JCC available, and plus or minus 0.25 and plus or minus 0.5 and plus or minus 0.75 and plus or minus 1. The commonly used cross cylinders are plus or minus 0.25 diopter and plus or minus 0.5. Plus or minus 0.25 diopter JCC used when the best corrected visual acuity 6/9 and better. Plus or minus 0.5 diopter used when the best corrected visual acuity 6/12 and worse. Principle of JCC, it is based on the Stump's conad by collapsing the circle of least confusion on the retina. Most of the JCC has a red and green marks. The peripheral meridians are marked in the periphery of JCC lens. Red marks indicate the axis of the minus cylinder and green indicates the axis of plus cylinder. The handle is attached between the two marked axes. Starting point of JCC after retinoscopy, adjust the sphere first so the circle of least confusion on the retina. End point of spherical adjustment is the starting point of JCC refinement. Refinement of the axis. Axis of cylindrical correction should be verified the JCC before the cylinder power. Because the correct axis can be found in the presence of incorrect power, but full power will not be found in the presence of an incorrect axis. This video shows about how to refine the axis. Put the cylindrical lens in the trial frame which you discovered during the retinoscopy. Occlude the other eye. Ask to focus on the distance object one line above the best corrected visual acuity. Hold the JCC handle parallel to the axis of the cylindrical lens in the trial frame. Flip the JCC as position 1 and position 2. Ask any difference between the two positions. If there is no difference found in the two positions, then the axis of the correcting cylinder in the trial frame is correct. If any one position patient says better, then the axis of the cylinder power in the trial frame rotated towards the red mark if the cylinder is minus. If cylinder is plus, then it should be rotated towards the green mark. The end point of rotation should be both the sides are equally blur or clear. This video shows how to refine the cylinder power. When refining the cylinder power, hold the JCC axis mark parallel to the cylinder axis mark. Flip the JCC as position 1 and position 2. Ask the patient any changes between the two positions. Then axis of correcting the power of the power of the correcting cylinder is correct. Power of the cylinder power is correct. If any one position is better, then increase or decrease the power corresponding to cylinder power in the JCC. JCC will reduce or increase the residual cylinder power, thereby making the target less or more clear. And also JCC can use to determine the presence of the astigmatism. If there is no astigmatism found in the retinoscopy, place the JCC at 90 degree. Video not on now. Place the JCC at 90 degree and 180 degree to check for the astigmatism. If any position is clear, then cylinder is added with the axis parallel to the respective plus or minus axis of cross cylinder. If there is no difference in the both the position, then keep the JCC at 45 degree and 135 degree to check whether astigmatism is present or not. So the points to remember, JCC is always spherocylindrical lens such that one meridian is plus power and the other meridian is equal of minus power. The red dots indicates the axis of minus power and the green or white dot is of plus power. While refining the axis, JCC handle is parallel to the tri-frame cylinder axis. While the refining the power, JCC lens axis mark is parallel to the trial lens cylinder axis. The end point is in JCC when both the sides are same. Thank you.